It's not always bad news right here on Dateline Abuja. Sometimes some good news happens. And even though the National Association of Resident Doctors have called off their strike, there is still an ultimatum for the 21st of April. However, today on the program, we do an update on the demands made the last time, especially by FCT resident doctors, what has been met and what is outstanding. This is Dateline Abuja. Hello and welcome to Dateline Abuja. I'm Kayla Magwa. Let's begin with some of the major stories this week from Nigeria's presidency. It's time for Abuja Wrap.
President Bola Tinubu has expressed deep sadness over the loss of the brave soldiers of the 29th Task Force Brigade, Operation Hadin Kai, who died in a terrorist attack on their camp in Benishiki, Borno State. In a statement released by the presidency, the president also expressed heartfelt condolences to the military and the families of the soldiers, urging them to take heart in the face of the unfortunate loss. President Tinubu praised the courage and heroism of the soldiers who fought valiantly to repel the terrorists and ensure that Boko Haram could not overrun the communities the soldiers protect. While mourning the death of the gallant soldiers, President Tinubu urged the leadership of the armed forces and all soldiers on the front line not to be discouraged, but to draw strength from the nation's deep appreciation for their sacrifices. The federal government says power generation will now be stable and electricity reliability will improve, as President Bola Tinubu has approved the payment plan to finally settle outstanding debts under the Presidential Power Sector Financial Reforms Program. According to the Special Advisor on Information and Strategy, Bayo Nanuga, the debt repayments plan followed the final review of the legacy debts that have beset the power sector for more than a decade. According to the statement, implementation has begun, with 15 power plants signing settlement agreements totaling 2.3 trillion naira. The federal government says it has already raised 501 billion naira to fund these payments. Out of the amount, 223 billion has been disbursed, with further payments underway. President Bola Tinubu says his administration remains determined to build a police force that is well-equipped, well-trained and well-motivated to confront the complex security challenges in the country. He gave the assurance at the grand finale of the 2026 National Police Day held in Abuja. Represented by Vice President Kashim Shettima, the president also calls for shared responsibility by the citizens in policing the nation.
We are determined to build a police force that is well-equipped, well-trained, and well-motivated to confront the complex security challenges of our time. We understand that no police force can rise above the value a nation places on its guardians. That is why our commitment is not rhetorical. It is practical, it is deliberate, and it is enduring.
Welcome back. The never-ending back and forth between resident doctors and the federal government is our focus tonight on the FCT in Focus. We're going back to 2025 when strikes were happening, the demands that were being made, what the government said they were going to meet, what they didn't meet, and where they are right now with all of those negotiations. Here's the back and forth between resident doctors, both at the national level and here in the FCT with the federal government. Please watch this. At this press briefing in Abuja at the end of October of 2025, the Nigerian Association of Resident Doctors, NARD, commenced an indefinite nationwide strike starting November the 1st, 2025, following the expiration of a 30-day ultimatum earlier issued to the federal government. The decision was reached after the association's National Executive Council reviewed the government's response to their demands during an emergency virtual meeting on Saturday. Among the grievances listed by the association are excessive and unregulated work hours, non-payment of outstanding arrears from the 25 and 35% upward review of the Consolidated Medical Salary Structure (CONMES), and the unjust dismissal of 5 resident doctors from the Federal Teaching Hospital, Lokoja.
The NEC demands the immediate implementation of the special pension benefits as previously agreed upon between the federal government and the Nigerian Medical Association. Number 19. After exhaustive deliberations and in light of the federal government's persistent failure to address the legitimate demands of Nigerian resident doctors, the NEC has resolved as follows. That the Nigerian Association of Resident Doctors hereby declares a total, comprehensive, and indefinite strike commencing at 12 a.m. midnight on Saturday, 1st November 2025. All resident doctors in federal and state tertiary health institutions nationwide are directed to withdraw their services completely and indefinitely until the federal government and affected state governments demonstrate genuine commitment to addressing our demands. This is the first time NAD is declaring a total action after 3 years. The last time we had a strike that lasted more than 48 hours was 3 years ago. So we were ready for that. We've been dialoguing for 3 years.
Medical services in hospitals nationwide were paralyzed as resident doctors constitute the backbone of clinical care in Nigeria's healthcare system. That same month, the FCTA's Mandate Secretary, Health Services and Environmental Secretariat, Mrs. Dolapo Fashawe, speaking during an enforcement exercise to tackle non-compliance of rubella and measles immunization across the nation's capital, appealed to health workers in the FCT to be patient with the present administration as all is being done to meet their needs.
I only need one leader to tell a congregation of 1,000. And a congregation of 1,000 would tell another congregation of 1,000. That is on the religious side. We have also been to chiefdoms, almost 17 chiefdoms in FCT, with this message, both in English language and happily so for the first time in Hausa language. We have even put numbers for you to call in case you do not understand. So what we are saying today is this is a new way of doing things. This is the renewed Hope administration. That's administration that goes all the way to the grassroots. We want social impact projects. You all see the beautiful roads. Now, those people that will walk those roads have to be healthy because health is the true wealth. I want to use this opportunity to appeal to the doctors in FCT. The frank truth is that no doctor anywhere in the world can be adequately enumerated for the kind of work we do. We are here on a Sunday. Bankers don't go to work on Sunday. The hospital is one place that the lights do not go off, and there's a doctor every time. So we cannot remunerate you adequately enough.
Last year, the Federal Capital Territory Administration procured a total of 12 units of ambulances for 1,741,500,000 naira. Briefing the media after the FCT Administration Executive Council meeting, which was presided over by the FCT Minister, Minister Nyesom Wike, Dr. Fashawe described the initiative as one that will greatly improve emergency response in the FCT and called on all residents to always call up the FCT emergency line when necessary.
A contract has been ratified, and I am very pleased to say for the first time in about 9 years, FCT will get 12 brand new ambulances. These ambulances are according to international standards and technical specifications. They have been delivered and will be commissioned soon. The essence of this is, with the good roads we have, it makes it easier for us to get into the suburbs. A journey that would have taken 20 minutes now takes 5 minutes. Now we have ambulances, it may take only 3 minutes. So this is another work that you can see. To the citizens of Abuja, call 112 and they will patch to the nearest ambulance, from FEMA to NEMSAS to FCT-HIS.
As the strike action of the Nigerian Association of Resident Doctors continued into November of 2025, with the action sharply affecting healthcare delivery across the country, the Minister of State for Health urged the striking doctors to suspend the action as the federal government has met most of their demands. The minister, who was speaking at a news conference in Abuja, said the federal government has cleared about 60% of the backlog of arrears of the health workers.
Let me use this opportunity to inform Nigerians that in 2024 alone, the Federal Ministry of Health, using a special waiver mechanism that no other sector enjoys, we were able to engage 14,444 health workers across 64 federal tertiary health institutions. 78% of those workers are clinical staff. 78.1% are clinical staff. Out of those clinical staff, 908 are consultants. 3,064, the second highest, are resident doctors. As at Thursday last week, the sum of 21.3 billion has been released for the settlement of these arrears. And this morning, when I checked with NERD members, at least 60% of them have gotten a lot of that. Yes, we're still remaining about 40%, and I think that we're going to follow up with the Accountant General and the Pay Office to ensure that the other 40% are promptly paid.
For the president of the Nigerian Association of Resident Doctors, more dialogue was needed to holistically address all grey areas.
I appreciate that the federal government is coming out, especially the Federal Ministry of Health, to talk about these issues. But it's important we take them to a finality. It's important we finalize them, we agree on them. It's important that concrete decisions are written on paper with actions, with timelines, so that it's something we can take back to NEC. NEC said 19 demands are minimum. Otherwise, strike continues. I'm happy to be at the negotiation table. I'm happy to put some of these things to paper so that we agree on them, we move on finally. Specialist allowance is also there, the infrastructure, the manpower issues. They talked about employing 20,000 people last year. We are good with that. But they should also break it down per cadre, per profession. And how many of them came to pick up appointments? How many of them are still in Nigeria working? So that these things are juxtaposed against the reality that 20 years ago or 10 years ago, we had 25,000 residents in Nigeria. Now we have barely about 11,000.
That same November in 2025, the resident doctors in the FCT said they had an even different set of demands. And even if the national body answered these calls and ended their strike action, they said they will continue to strike in the FCT until their demands are physically met.
We're talking about people who are supposed to save lives. They are not even passionate anymore because of these issues. It shouldn't take time. Doctors are resigning, nurses are resigning, pharmacists are resigning, and then you want to apply some rules that we know are not helpful. Even if not cause of their own, we're going to prolong hours because our demands have not been met. So what is more important than fixing the issues that have been on ground? This is just painful.
The FCT resident doctors demanded the immediate payment of salary arrears, the immediate recruitment of doctors, payment of the 2025 Medical Residency Training Fund, unexplained deductions in monthly salaries, immediate release of timelines for promotion exercises, conducive working conditions, urgent renovation, equipping and upgrade of FCT hospitals, payment of outstanding hazard allowances, amongst others. On Tuesday, April the 7th, 2026, the Nigerian Association of Resident Doctors declared another indefinite nationwide strike, citing what they described as the federal government's plan to halt the implementation of the revised professional allowance table, a key component of agreements reached after its 2025 industrial action. The decision was reached at the end of the association's virtual Extraordinary National Executive Council meeting. NARD's national president described the development as unfortunate, stating, quote, "We demand the reversal of the decision to cease the implementation of the PAT starting in April of 2026. There must be an immediate payment of promotion arrears and salary arrears in affected centers, as well as the prompt conclusion of the process of paying the 2026 Medical Residency Training Fund. We also insist on the immediate processing and payment of the outstanding 19 months arrears of the professional allowance." End quote. Just a day later, on the 8th of April, after a meeting with the association's National Executive Council, NARD suspended its indefinite nationwide strike. The association said they had received assurances from the federal government on the reversal of the decision to cease the implementation of the Professional Allowance Table, PAT, starting in April of 2026. NARD decided to give the federal government an ultimatum of April the 21st after which they say a strike action will be inevitable if demands have not been met. Will this promise be kept this time? And will the back and forth between resident doctors and the federal government be resolved? Only time will tell. However, one thing is certain. The Nigerian people are the real victims of this impasse that has cost the lives of many Nigerians seeking medical treatment. Here with an update on some of the demands that have been met by the FCT minister and some of the demands that are still outstanding with FCT resident doctors is Dr. George Ebong. And he also tells us about that April 21st deadline given by the national body if their demands are not met. Dr. George Ebong, welcome again to Daily in Abuja.
Thank you for inviting me.
I feel like we need to do this update from time to time, just so people can understand where things are. So the last we heard, Nad said we were going to go on, that's a national body. You're the chairman of the FCT chapter.
Yeah, the president of the FCTA.
FCTA. Yeah. So Nad said we were going to go on a strike. Then they said they weren't going to, said some kind of assurances had been given.
Yes.
Are those assurances, as a member, because for that one you are a floor member of NAD, are these assurances ones that you believe will be kept? Because this dance, for those who watched our report before this, they can tell it's been going on. The dance, they'll promise, then nothing. Then you go on strike, then they promise again, then nothing. Then they go on strike. Is this the one they're going to keep?
Yeah, we're optimistic because the NAD president and the NAD executive met with the vice president.
Okay.
And he's been promising. The previous strike that NAD had, the vice president was the one that interceded, and it worked. So this time around, he did the same thing. And then the NAD president had a discussion with us as center, the local chapters, the president and the secretaries, and we believe in his leadership. So we're optimistic that it's going to be the way we were told, so that we can have a harmonious working relationship.
Just so people can understand why NAD had threatened in the first place to go on strike, how does that decision, or what are the issues that led to that decision, in your view?
Okay, so we have this issue on the professional allowance table that has to do with fixing the mismatch between the salaries for some time. And then we have the specialist allowance as well. And of course, the other issues have been there. And so when there was this rumors that we're not going to continue with implementing the correction that was made, that was what led to the threats. But just like I said, as soon as the vice president stepped in, and there was assurance, and of course we have to believe the vice president. And the last time he did something, so this time we're also optimistic that we can take him for his word.
What assurances did he give the last time, and were those met?
The issues that were there was based on this same thing. And then, of course, there were some doctors that were victimized at Lokoja, which, of course, they've been recalled. So all those things were there, and the vice president actually stepped in. I think he was actually the only one that actually stepped. I mean, not the only one, but the highest ranking person
Yes.
that stepped in, and he showed good faith. And I think that is what most of the government officials have come to understand about doctors and associations, that when you show good faith, we're going to listen. But the problem is sometimes they just feel like they can just push us around, and then they expect us not to react. But when we come to meet you, and then you talk, we have a dialogue, and we know that you're working so hard to get things done. Of course, we're not going to want to go the other way. And the same thing on FCT as well. So we have, since the last time till now, we've had good working relationship. So now they understand where we're coming from. We don't want anything that will kill the medical profession, the medical system. So we have this conversation. So they understand that we want more hands. And of course, the minister has approved that employment should be made as soon as possible. We had some arrears that some doctors that were owed the last time, if you remember, they've been paid. I mean, the salaries they were owing them. The medical residency training funds that they were owing them, they've been paid. The promotion exam has been done. The skipping that wasn't done has been done. Of course, we have some things to do with the skipping arrears, etc. So these are the things. And there are some that have not been done yet. On the FCTA level, like this professional allowance table, the specialist allowance as well, but we're having a conversation. And so there's seriousness on their part, and so we're listening. And we believe that sooner is going to be fixed as well.
Just so people can remember, at the time, it was also about the quality of work.
Yes.
And remunerations were an issue for doctors in the FCT at least. So you say some things have been met. What would you say is the major thing that has been met since the last time you had the strike for the FCT?
So the major thing has been the payment of the doctors that they owed for like 2-3 years.
Okay, so that has been done.
Oh, that's been done.
Oh, good.
The hazard allowance that had not been paid since 2021, that has been paid. The wage award, that has been paid in tranches. Then the MRTF, that has been paid. Of course, then the promotional exam that has not been done for some time, that has been done. Then there's a skipping, that has also been done. But of course, there are some arrears that we're trying to work on. Then we have the postpartum conversion, those that passed and are consultant, but they've not been moved. Yes, so they're getting that letters right now. But we have some areas to talk about as well. And so that shows good faith. So when we see that you've shown us a good faith, we're going to meet you halfway. So I think we understand each other now, that we're not those enemies to the system. We just want a better system. That's all.
I think this conversation was very important because we're not just here when things are bad.
Oh, that's correct. That's correct.
We have to be able to say that, okay, well, since the last time we said this was a problem, these are things that have been sorted out.
We want more.
Yes.
But for now, we'll keep that. Okay.
I was going to say, what more? Because it's never enough, is it? When we look at the health sector just generally, the amount of doctors that leave this country.
Right.
I was talking to a doctor recently, and he was saying that when he was in school, it was about 70% of people in his class who left the country.
Yeah.
But right now, it should be about 90%.
Even the lecturers are leaving.
Even the lecturers.
Professors are leaving.
And you were talking that last time you were here, you even talked about the fact that some doctors themselves are even on narcotics right now because they're not able to give that kind, they're not able to deliver the kind of health care. Has that been assessed again? Are your doctors doing better now?
Well, so what we're trying to do is to work on the psyche of doctors. And when it comes to the standard of living, we are severely affected, okay, in comparison to what we're earning. So when you can't meet up economically, it becomes a problem, even a mental problem. And of course, at our place of work, we still have more hands. We need more hands. And like I said the other time, we had a meeting recently with the chief of staff to the minister. He's a very good man, I will say it like that, because he seems to really understand us, and he tries to make sure that he goes the extra mile to see how he can get things done. The Monday secretary was there. I mean, she's the closest to us. She's a senior colleague.
Dr. Fashawe.
Oh, yes, and she always tries to find a solution to whatever problem we have. We were there with the head of service. We have a cordial relationship with her too, because we have dialogues. And I think, like I said, there is this understanding now that, okay, you guys are not rebellious. You just want to get these things done.
For the hospitals that can't cater to the number of patients that come in, we had that conversation.
Yeah, we did.
Earlier.
We did. And then one of the meetings we had with the chairman of the Civil Service Commission was there. It was called by the chief of staff to the minister. It was about how to employ more hands that the minister had approved. So we're still waiting for that exercise to take effect.
So while they're working on that one for the national body, as we wrap up, April 21st is the deadline.
Yeah, the national body. I have to give kudos to the NAD president. He has a very unique way of, he has a unique style, and he's done so well. So when he had an interaction with us, and he laid down the process to lead into the progress of what we want, we all felt that we should give him more time for the dialogue with the powers that be. So, and he's been working on it. We just want to see how this will take us far, so that we can always dialogue and get the results, and not have to doubt to get whatever results we're getting. That's painful on both ways.
Well, that's about the time that we have our fingers are crossed for April the 21st. Thank you so much, Dr. George Ebong, for being here on Dateline Abuja, and good luck with all the other advocacies you have going on.
Thank you. Thank you so much for the support we get from you and the rest all the time.
Thanks to my guest and to everyone who spoke to us today on the program. It's nice when we make advocacy and we start to hear that things are being done as a result of the things that we've asked for. More needs to be done for the resident doctors, both at the national level and at the FCT level. And we'll be keeping up to date on all of these proceedings and what is being met and what is outstanding. Please remember to let us know the happenings in your neighborhood using the social media handles showing right now on your screens. Thank you so much for watching. I'm Kayla Magwa. See you next time.